Hi there, my name is Jessica Abawag, and I'm a speech-language pathologist and owner of Fluens Children's Therapy. We have locations in Tacoma, Washington and Columbia, Tennessee. Our clinic provides speech therapy for kids ages 18 months to 18 years, and we specialize in the toddler preschool age range. Today we're going to talk about how a speech disorder may or may not affect your child socially. Many parents that come to our clinic will ask us if having a speech sound disorder or a language delay or even stuttering, how that will affect their child socially. And it's a totally understandable question, especially as kids get older and interact with peers, and especially if they're coming in to see us and they're a little older themselves. The answer is, it really depends. I've worked with kids who were totally unaffected by their speech sound disorder. A lot of people couldn't understand what they were saying, but they compensated for that by using gestures. Sometimes kids drew pictures, and they just had the type of personality that they weren't visibly affected by how others perceive them socially with their speech sound disorder. Other kids were on the complete opposite end of the spectrum, where their speech sound disorder or language delay really did affect them socially. So what we talk with parents about is to find a balance, especially when it comes to things like stuttering or articulation, in the sense of other people can't understand what they're saying, but the kids already know what they're trying to express. We try to find a balance between not overcorrecting, and especially as they start getting into therapy, parents get really excited, which is great, and they want to practice at home, which we totally encourage, but we tell parents not to overcorrect all throughout the day, but to find specific times of the day that kids can expect that they're going to be working on their speech sounds or whatnot, whether it's during bath time or dinner time, or there's a special dedicated maybe school time if they're homeschooled. And that allows kids to not have to inhibit their thoughts or their emotions or what they're trying to express by worrying too much about how others will perceive them socially, but they have a predictable time of when they're going to practice those speech sounds. We also want to find a balance between kids not getting too frustrated when it comes to their language delay or speech sound disorder or even stuttering. And so what we will often do is offer alternative ways for kids to communicate, and we'll discuss that with the parents in terms of if they're not speaking words or not speaking words very clearly, maybe they use an AAC device, maybe they use pictures, maybe there's a simpler word they can use to express that, maybe they use a lot of gestures, maybe they use some simple sign language. So we try to balance that social aspect of getting really frustrated with finding a bridge or another tool that kids can use to help communicate with others without getting so frustrated. And then when it comes to, if the kids are older and they're getting into school or even teenagers, we have those types of conversations about how they can advocate for themselves when it comes to communicating with others so that those social interactions can still be maintained. Things like asking people for more time. If somebody asks a question and they need more time to process or think about what's being asked or even to formulate their ideas, we teach kids things like, can I have more time? Or can you say that again? Or I don't know is a great tool that we teach kids, because sometimes they don't know and they need help, but they don't know how to ask for that. Or we'll even have them say, can you repeat that? So all of those self-advocacy tips and teaching them those phrases or, again, pictures to use or gestures or whatnot, or even written out, having them have a written out card so others can know, are all great ways for us to support that social development and those social interactions as they are learning to communicate more clearly with others. And speech therapy and the kids that we work with and the tools and the strategies and the treatment that our therapists use can all help support those social skills while kids are learning to communicate more clearly. So if your kid is struggling with formulating sounds correctly, putting sentences together, maybe they're stuttering some, don't hesitate to reach out for help. We'd be happy to see if an assessment will show that support services are needed. So feel free to give us a call, and we look forward to hearing from you.